So I'm going to be giving you tips, Needy. Just be very patient, okay? I'm going to be giving you all the tips you need to successfully process Part A. So let's look at the overview. So first of all, Part A is very specific. It's administered separately to Parts B and C. So basically, it's about fast and efficient reading, and there are techniques for each section, okay? And the techniques for the first section, the first 7 questions, are different to the techniques for the short answer and the sentence completion. So I'm going to go through all 3 sections, okay? So just be patient. So you're going to get 4 short texts presented to you. There are 20 questions in total. Basically, you have 15 minutes to answer those questions. So this is a time-pressured section of the reading. So basically, matching short answer, sentence completion, and time is the challenge. So we do need to follow this technique, and you do need to follow the technique I'm going to give you in this order, because basically processing macro to micro on the Part A, that is how the test has been designed. So that is definitely how you should approach it, and I will be explaining why. So various test features. So these texts that you're going to get at the beginning in Part A of the reading, it could come in the form of a table or bullet points, okay, like this. It could come as a visual or numerical information, like this is a flowchart, for example. It could be footnotes. So when I say footnotes, you see the little asterisks here at the bottom. That is a footnote. So don't overlook those, that aspect of the reading. You might find information in a footnote, so that's something to be aware of. And then also you get what we call the continuous prose, where you need to basically do, we're going to be looking at skim reading in a moment, where you need to extract initially just the main sense of what is this text, what aspect of the overall information is this text delivering. Also be aware, guys, that there will be different fonts. Don't let that throw you off. It's just a stylistic thing. So you need to be just aware that it might come to you in different fonts. That's just kind of how it's presented. So just be aware and be ready for the different kind of text features that you will be presented with. So getting started, we're going to start with something called skimming. Now, skimming, I just want to be very clear what skimming is. And I'm just going to quickly check in my chat box. It's pretty hectic today. Yeah, okay, I can see you guys are all exchanging numbers. Wonderful for speaking practice. Good stuff. So, yeah, skimming practice is when you initially, for the first 7 questions, you're going to get the 4 texts. So when you get Part A of the reading, you go to the texts first, not the questions, and you would do an initial 15-second skim of each of the 4 texts. So there will be an over topic, okay? So all 4 texts will be about the overarching topic, and then each text is going to present a different aspect of that topic. Okay, so all you need to do is a 15-second skim to think, oh, this text is about this aspect, etc., etc. You're not reading for detail at this point. So I'm going to, basically just to work out quickly what the text is about. This is what skimming is. So you're going to look for any graphic elements, for example, pictures, look at any headers or subheaders. You're going to run your eyes quickly down the text, not aiming to pick up every word, but just seeing which words kind of stand out in terms of content carrying important meaning. So I'm going to give you a practice, and this practice is going to be actually with continuous prose. So basically some of the text will be blocked out, and the aim here is for you to run your eyes vertically down the text, picking out words that carry content and meaning, and then type into the chat box what you think in just a few words this text is essentially about. Okay, hopefully if you're ready, we're going to do a practice now. Okay, we've got over 300 in the class, so I'm going to pop out while you do this. Okay, so just in a couple of words, type into the chat box what you think that text was about, please. Okay, doesn't have to be a sentence, just a few words to give me the general gist of what that text was about, if you wouldn't mind. Liver disease, caffeine intake, pregnant women, relating to caffeine, okay, effect of coffee on pregnancy, okay, stress hormones, okay. Okay, so we're getting similar kind of words. Excellent. Okay, so that basically would be a 15-second skim, and that's what you need to do on all 4 texts. So let's just confirm that on the screen. We've got these words highlighted in blue. If you have a look, pregnancy, liver disease, offspring, hormone levels, coffee, impaired growth, prenatal, non-alcoholic, fatty, prenatal, coffee again. So birth, liver function. So you got it, basically. So let me just show you what a sort of a summary might be of a text like that. So it would be something like excessive caffeine during pregnancy may impair baby's liver development and increase the risk of liver disease in adulthood. So that would be all you would need to do in a 15-second skim. So now what I'm going to do is I'm going to preview what you're going to be reading about. I'm going to give you each text and I'm going to put you on a 15-second timer, and I'd like you to do the same thing. Just skim it and type in just a few words, 1 to 4 words, what you think is the essence of each of those texts. All right? So, ready to go? I'm going to put 4 up. I'm going to pop out while you do it, and we'll check the answers together on the back end. Okay, so I can see that the questions are going, not the questions, sorry, the answers are going thick and fast into the chat box. Well done. So I'm now going to put up the answers and you can check against what I have on the screen. So the first, basically the topic is, as you probably gathered by now, about seizures. The first text was about signs and symptoms. Text B was about meds. Text C, classification, and text D, diagnosis. Now, why do we do this initially before we go to the questions? Well, the first 7 questions are what we call matching questions. So all you need to do is identify from the question which text contains that information and match it and put the letter of the text. This is done initially because when we are processing information as we're reading, we tend to naturally, our brain tends to naturally process macro to micro. So we are getting big picture first, and then later for the short answer and for the sentence completion, we will be changing technique and we will be dealing more with reading for very specific information. But for the first 7 questions, it is not necessary to read in any detail. So skimming is the way to go. Now, some students that I've taken in tutorials, for example, who get really stuck on this, they say, oh, but my friend told me that I can just do the questions 1 to 7 at the end. I do not recommend that. That is not the way the test is designed. If you do the pre-skim, okay, for the first 7 questions, so you go to the text first, do a pre-skim, 15 seconds on each text, that is ultimately going to save you a lot of time in the later sections for short answer and sentence completion questions. So this is actually a time-saving device. It's not a time-wasting device because it's going to speed up, as you will see, the later sections of the reading. So I'm just going to check in my chat box, make sure there aren't any questions. Yeah, Ramona, thank you for putting in your comment there. I have a long history of teaching reading skills, guys, okay, for many exams, and I know that there is often resistance to doing this. My recommendation, Ramona, would be to try it this way and see if it helps, okay? Because if you think about it, in the later sections, if you've done a pre-skim, when you get to the short answer and the sentence completion questions, when you get the question, you don't need to think which text is it in, and go through all four texts to find the specific answer to your question, because you'll already have a very good idea which text to go to do your scanning in. So we're going to get to that in a little while, okay? So those of you just joining the class, by the way, welcome. So please explain pre-skim again. Okay, very simply, guys, pre-skim is for the first 7 questions, you do not look at the questions first, you look at the text first, and 15 seconds, you do a quick up and down, or making note of any headings, anything that stands out, 15 seconds to do a surface read to get the general gist of what aspect of information is being conveyed in that text, no detail. So we've done that now. We've got signs and symptoms are in text A, meds are in text B, classification in C, and diagnosis in text C. So it's all about seizures, but they've broken down that topic into 4 distinct texts, okay? So matching questions, this is what it looks like on the actual test day, okay, on your test paper. So these are what the questions look like, and all you'll need to do is read the question then, having done your pre-skim, and it says the correct route for the administration of chlorpheniramine. Which text is it in? You think, I think it's in text A. Let me just check quickly. You do, and you quickly check, yes, that's the one about medications, okay? So you're going to just put the letter in the answer sheet. So those are the instructions, okay? Just going to put A, B, C, or D. You've got 7 questions, 4 texts, so of course you will be using some of those letters more than one time. So I'm going to give you some matching questions to practice now. I'm going to give you 5 practice questions, and I'm going to change the settings on the chat box so that you can basically put your answers in without being distracted by other students. So I'm just going to temporarily alter that, and I'm going to give you some practice to do your own 5 questions, guys. I'll pop out while you do that, and I'll put you on a timer. Okay, well done. So I can see the answers going thick and fast into the chat box. That's absolutely brilliant. Now, of course, for the first 7 questions, we've only done 5 just now. For the first 7 questions, you're going to need to move pretty swiftly because you need a little bit more time when you get into the other sections. So I would say aim for about, so that if you can, get the first 7 questions answered in about 3 minutes or so. That would be a general rule of thumb on the timing. I'm going to just change the settings back now in the chat box, so if there are any questions, you can see each other's comments and questions in there. So let's go through the answers together. Matching questions. So first of all, the first one, we were looking for the text that contains types of injury that may be sustained during a tonic-clonic seizure. So we would be looking for keywords there, and we were thinking, okay, types of injury, where would that be? And it's actually in text D. If you look there, we've got seizures, diagnosis, and then we've got basically under diagnosis, is it a first seizure? And then another section there for tonic-clonic seizures. So that is where the answer is. It's in D because it's talking about the types of injury, and it gives actually 3 different types of injury: tongue biting, knee abrasions, and head injuries. So tick, we found the text. All we need to put in there is text D. Just put D in the answer sheet. Number 2, okay, we're looking for this time which text contains which behaviors occurring before a seizure to record, and that was in text A. Okay, so basically before a seizure, all pre-seizure signs and symptoms, okay, signs and symptoms, behaviors should be documented, is going to match with the word record. So that information then, all these bullet points underneath, but that information is found in text A. All right, so pre-seizure, meaning occurring before a seizure, observed signs and symptoms or behaviors, and then documented matches with record. So that information is found here in text A. Number 3. So which text will we find information on the different types of seizure? This is nice and easy because we've got basically in text C the different types. It's laid out in a nice kind of chart. So we've got the focal onset, generalized onset, and unknown onset seizures, and then at the top it says seizure classification. Okay, so that is the different types of, or those are, I should say, the different types of seizure. So that was clearly in text C. So that's all we're doing in the first section. We're just orientating ourselves to the information, being secure in where to find which type of information, and that's going to help us later. So basically, which text now can we find different routes of administration for anti-seizure medications? The answer is B. So medications we know is in text B. Okay, anti-seizure medications and the different, but we're looking for the different routes of administration. So that is one of the bullet points. It says for adults, it can go through IV, IM, intranasal, PR. Okay, so basically it gives you the different routes there. We don't need to say specifically what they are, we're just saying which text we can find the different routes of administration. So those are basically bolded out in text B. The last one, number 5, in which text can you find info about the typical medical definition of a seizure? So a definition is what we're looking for, and that is found in text D. So definition, we're using the verb here, okay? So the noun is in the question, but actually we're going to match that with seizures can be defined as, so we're using the verb defined rather than the noun definition, but we want the typical definition there as episodic neurologic dysfunction caused by abnormal neuronal activity. Okay, so there is the definition. They're just using the verb instead of the noun. So we've answered all 5 questions. And I'm basically being asked now by Ambati, what score needed for the B grade in reading? Excellent question. So for the reading, let me just talk about that. For part A, part A is administered separately to part B and C. So in part A, there are 20 questions and you need to score over 70% is the guideline from OET. So 70% of part A would be 14. So when I say it's a guideline, you would want to be comfortably scoring, say, 16, 17 consistently in part A, to know that if you can do that consistently, you've got a very good chance of scoring a B, okay, in the test. Something else I should point out, that part A and part B and C, they are administered separately. So you need to score a B in part A, and you need to score a B in part B and C combined as well, because each section of the reading is testing different types of reading, so you can't carry over from A into the other sections, for example. So you need to score over 70% in part A, and you need to score over 70% comfortably and consistently in parts B and C, okay, independently. So short answer questions. Note the spelling requirement. So in this section, it's a very different approach. You're going to be lifting information exactly as it appears in the text and putting it into your answer sheet. So there's actually no reason, you need to be careful, but there's no reason for any spelling mistakes. You're not going to be altering the answers. You're taking them directly from the text. So again, you'll have the 4 texts, and you need to write your answers on the spaces provided in the question paper. It doesn't specify the number of words. It says a word or short phrase from the text. It may include words, numbers, or both. So we have some examples of questions which will be in the short answer section. So let's have a look at these questions, and then let's also have a look at the types of answers that you would need to put into the answer sheet. So this is a what question, okay? What should be used to elevate a patient's fractured leg? A rolled up blanket. What is the maximum dose? So you think you're going to need a number of some sort. You're going to be scanning in a moment for a number. The maximum dose of morphine per kilo of a patient's weight. 200 micrograms. So think clearly, what exactly is the question asking me? So you need to be very clear, and there is a 5-step method that you need to observe for this section of the reading. So now we've moved away from the first 7 questions. We're going into the short answer section, and this is where we go initially to start with the questions, okay? So we're starting with the questions. We need to read the question and identify key words in the question. So words that carry content and important meaning. There's absolutely no point sort of reading the question and then diving over to start reading the text in great detail unless you have the key words. The reason why you need the key words is because you don't need to read the whole text. You need the key words to then take those key words. You will by this time have a very clear idea which text to go to because you've done your pre-skim. So you take the keywords, and then you're going to be scanning that text, A, B, C, or D, whichever one it is, for matching words or synonyms to locate the section of that text where then you need to do your careful reading. And then you're going to read around that section, and this reading that you're doing now, having scanned and located, this reading needs to be slowed down and careful reading to get the answer to your question. And if you don't find it in that particular sentence, having done your scanning and your location to find the matching keywords or synonyms, you might need to read the sentence before or possibly the sentence after, or if it is a table, you might need to read a little more broadly to find your answer. So that is the 5-step technique, okay? All right, so Jobin, I'm so sorry, but B and C is not being dealt with in this live class. I will be dealing with that next week, okay? I just can't do all of it, so we kind of section it off in the live classes, which go out with E2 language every week, okay? So we alternate it. New week starts every Monday, so next week I'll be looking at B and C. So those are the 5 steps that we basically are covering for the short answer questions. And then, so let's do an example. Say, for example, you identify maintain warmth in your question as key information that you need to be scanning for. So then you go to the text, you think, I need to find the section that deals with maintain warmth. So then you scan, and you find, oh, keep warm, that is a match, okay? So this is the section that I need to read carefully in order to answer the question. So we're going to do a quick practice scan, guys, to get you warmed up. We've got these items at the top in blue, I'm going to give you 30 seconds to just scan this table, see how quickly you can find these words. And scanning, all it means is locating, hunting and locating. Okay, so all I wanted you to do is locate the answers. So let's put them on the screen. So we've got C5, hallux, F16, we've got delusional, B18, vaccination, so E29, supination, D32, laryngeal, and 35, dehydration. So that is basically scanning, identifying keywords in the question, using those keywords to scan the relevant text, locate, and then do your careful reading to answer the question. All right, so that basically, yeah, Mohammed's saying it's a game. You like that, okay? You enjoy that. So basically it's a technique, okay? Scanning. There isn't time to read each section, each text, every single part. So you use scanning to do your precise location of the information that you need to read. So keywords in the questions, let's give you some examples. This question is asking how long, okay, repeating a dose of diazepam. So say you've highlighted those as your keywords, then you know that you are going to be sort of hunting, scanning for those keywords, because now, instead of reading for general information like we did in the first 7 questions, now we're reading for very specific information to answer the question. So number 9, what is the other term? Non-motor generalized. So other term, non-motor generalized. So we're thinking, probably this is going to be, in terms of terminology, it's probably going to be in text C, right? Because that's the one that gives you the different types of seizure. So we need the alternative term for non-motor generalized. So we would go to text C and start scanning there to find the answer to the question. So are you ready to do so? I'm going to give you 5 practice questions just to get you into the habit of using this technique. I'm going to pop out while you do it. Okay, let's go. I'm just going to change the settings so you're not distracted by other people's answers. Okay, so I've just changed the settings in the chat box. I'm going to put you on a timer. We'll check the answers together at the end. Okay, so I was putting you under a fair amount, sorry. I was putting you under a fair amount of time pressure there, but basically it's quite similar to the timing. I just want to say one thing before we check the answers, and that is that basically what I would work on first when I always, when I take students for tutorials, I always say to work on your technique first. Make sure that you are really strong on your technique and that you are getting consistently the right number of answers correct. And then once you've got the technique down, then you can always work with practice. You can speed up. Okay, so I would say technique and accuracy first, and then work on your timing. So basically, you've got 15 minutes for part A. So you want to get the initial 7 questions done, the skimming and the answer, just matching questions, done in about 3 minutes, which will leave you with just under a minute for each of the questions for short answer and sentence completion. So that basically is the timing. We're going to go through the answers now together, guys. So the first answer for number 8, how long? So we need a length of time. That's very clear. How long should you wait before repeating a dose of diazepam? So a dose of diazepam, repeating it would be keywords, and we know that we're going to find information about medications in text B. So then you're going to start scanning for diazepam, which is here, and then basically repeat once 15 minutes later if status epilepticus continues. So basically the answer is 15 minutes. That was found here in text B. So you need those keywords. So you know that the information is going to be in text B for medication, and then you pick up the keywords, repeating, dose of diazepam. So you've got diazepam, repeat, and then the question is asking how long should you wait? 15 minutes later. Okay, so basically you should wait 15 minutes before repeating the dose. So there is the answer. Let me just change the settings in the chat box now so you can see, you can chat with each other if you have comments. Okay, so I'm going to just put the settings back for the community settings in the chat box. Great. So number 10, we've got, what is the first stage in managing a seizure in the emergency department? So managing the seizure would be keywords, okay, an emergency department. Where would we find that information? So basically, if we basically go to text D, we would scan down and we would find, sorry, text B, excuse me, I need to go back one. Managing the seizure. Sorry, I've got a very, I didn't even touch my mouse. I just hovered my hand over it. Sorry about that. So the first stage in managing the seizure in the emergency department, you would go to text D and you would see the word management of seizures, and then you've got in the ED. So ED is obviously emergency department. So you've done your scanning using the keywords. Now you need to read that information carefully. So we're wanting to know what is the first stage, okay? And it's numbered 1, 2, and 3. So the first stage would be terminating the seizure. That's the answer. Number 11, keywords. So what should practitioners be ready to do for older or weaker patients giving midazolam? So midazolam obviously is the brand name of a medication. We know that's going to be in text B. So what we want to find out is what do practitioners do for older, weaker patients? So we can see highlighted there that we've got frail, that matches with weaker, and older, elderly patients. So what do practitioners need to do? It says they need to be prepared to support airway and ventilation. So support airway and ventilation would be the short answer to that question. Number 12, what type of seizure? This is a nice easy one. So what type of seizure may imply a retention or partial loss of consciousness? So retention means to keep, and partial loss means part loss of consciousness. So the answer is focal onset. And this is nice and easy because it's saying what type of seizure. That is clearly going to be in the one that deals with classification in text C. So the answer is focal onset. So there we have our answers to those short answer questions. And now we're going to move into the third and final section, which is sentence completion, which I think is probably the most challenging. But the good news is by now you've got become quite familiar with the type of information which is in each text. So as long as you are identifying keywords, you should be able to find this information fairly easily. Okay. Adriel is asking me about essential abbreviations. Adriel, I would like to direct you to one of our writing live classes. If you can access the recorded classes on the E2 language platform, I've just dealt with abbreviations in a writing live class last week. So week 8 of our live classes for writing deals specifically with abbreviations. So you can either access it through the recorded classes, but the writing classes, or if you want to talk about that in a one-to-one basis, if you have a lot more questions, then I would save up all your questions and use those questions, get them all answered in a one-to-one tutorial. But specifically about the abbreviations, we dealt with that, or I dealt with that in a writing live class actually last week. So good question. Week 8 of our live classes for writing, they're all recorded on the E2 platform. Okay, right. So guys, I might have missed out one question, in which case I do apologize, but I'm just giving you kind of the technique today, not a full test practice, because I want you to focus on the 5-step technique for the short answer questions. So sentence completion, we're now going to look at the technique for this one too. What I want you to take away from this live class is a clear understanding of how to approach the questions and get your level of accuracy up to a good standard, a B standard, and then you can work on your timing and a full set of questions. And don't forget, we have plenty of practice materials on the E2 language platform as well, on the student page. So sentence completion, again, the instructions are a word or short phrase from the text. It doesn't specify the number of words, so just to be clear on that. Each answer may include words, numbers, or both. So we've got examples of what the questions might look like. So we've got number 15 and number 16. So you need to kind of look here and think about what's missing. Read the whole sentence and think what information is missing in the gap. So this is a similar technique to the short answer question, except we've got one more layer, and I'm going to be going through the 5 steps, so the extra layer here for the sentence completion. So the first one is you're going to read your sentence and analyze where is the gap? What type of information is missing? Using your knowledge of grammar, is it a noun? Is it an adjective, a dose, a medication? So what's missing? What kind of information is missing in that gap? Then you need to, same thing, don't rush off to start reading, please. Go first and identify the key words around the gap. You can underline them on the question paper. You need to be very specific, always. Don't rush off and start reading only to think, I'm not sure exactly what I'm reading for or which area I'm supposed to be reading. These are the steps to do in this order. So you've identified what type of information is missing. Then you're going to identify and underline the keywords in the sentence. Then you're going to use those keywords to go to the correct text, and then you're going to start scanning for those keywords or synonyms. So this is where your knowledge of vocabulary will come in handy, to find synonyms that have the same meaning as your keywords for locating the answer. Once you get to the correct section that you've located the keywords in, then you need to go back to the beginning of that sentence or the beginning of that section and do slow, careful reading and find out, okay, is this a match with what's in the sentence? And which part of information was I looking for? What's the missing part? And find it then in the text. So when you've decided what part is missing and you found it in the text, when you insert it into your sentence, you should read your sentence through to check that it does make grammatical sense, okay? Don't repeat, don't put words into the gap which are already dealt with in the sentence. Just put what is missing and then read your sentence through just to check it reads grammatically correctly. So keywords, okay, might be something like this. Can't, categorized, little information, referred as. Okay, so you're thinking this is about categorization. This is probably going to be in the section where it gives classifies the different types of seizures. So probably it's going to be in text C. You've got your keywords, can't categorize because there's little information, and what is it referred to as, and then you need to put the information in the gap. So are you ready to do some practice? I hope so, because I need to move on. I am now going to change the settings again on the chat box so you can put your answers in without distraction from other students, because we do have over 300 in the class. Okay, let's go. Again, I'll pop out and I'm going to put you on a timer as per the timing that you're going to be experiencing in the actual test. Okay, so I've cut you a little bit short there, and I do appreciate that we are moving at a very rapid pace today. But like I said, ostensibly, I want you to take away the technique, okay, and then go off and do some more practice. We have plenty of practice materials with the exam-like questions on our platform, on the E2 language platform. So I would go there initially and start doing a practice if you want to sign up with E2 language to get your practice in. And, you know, we're basically putting out different materials and rotating them on a weekly basis. So next week we will be dealing with part B and part C. So take a breather and let's go through the answers together now. So as I did warn you at the beginning of the live class that there's a lot to get through in these our live classes, so we tend to go a little bit, or at least I tend to go a little bit over. So basically, sentence completion. Okay, the first question we would say, what would we take away from that? Seizures which can't be easily categorized or about which there is little information are referred to as. So we're looking for categorized, little information. What are they referred to as? Now, this is a bit mean because this was actually in a footnote, which is very small on the screen, but it's actually down the bottom here. And remember I said about footnotes at the beginning, make sure that you do look at footnotes. And basically there's a little asterisk here. And if I could enlarge it, it actually says unclassified. So sorry about that being very small. Moving on to the next question. So obviously that would be bigger in real life, but it's a footnote right at the bottom here. So yeah, basically that was where you would find the answer. So when there's little information, those seizures are referred to as unclassified. So it says here, seizures with patterns that do not fit into other categories or there is insufficient information to classify the seizure. So they're called unclassified. It's got it at the beginning there. So it was a little bit small though, apologies. 16, it is important that practitioners look for involuntary muscle activity such as eye blinking. So important, look for, and eye blinking would be the things I would be looking for, and that's quite easy to find here in text A. So basically eye blinking there, we've got examples such as lip smacking and eye blinking. So basically how is that headed out? The presence of, they're looking for the presence of the absence of involuntary muscle activity, and then lip smacking and eye blinking are just examples of the absence of involuntary muscle activity. Okay, so that would be the answer for number 16. So it says, yeah, so the examples would be eye blinking and lip smacking, but what it is that they are looking for is involuntary muscle activity. Right, number 17, continuous seizure for more than 5 to 10 minutes without regaining consciousness is known as status epilepticus. So we need to find status epilepticus. Where are we going to find that? It's down here in text C, and then also it says continuous seizure for more than 5 to 10 minutes. So those are numbers, which are also good keywords because they're quite easy to scan for. So we can scan for the numbers. We're going to find it down here in text C. So what part is missing? Without regaining something. Okay, so basically without a return to full consciousness. So without regaining consciousness, or I think full consciousness would also be accepted in this particular answer. Okay, so that's number 17. Number 18, no medication is needed for most seizures because they will end in 2 minutes or less. You don't need to write or less because that's in the sentence, okay? So don't write or less. You just need to write the missing part. So what would be the key words there to help us locate the information? Medication, so that's already going to guide us to the correct text because we did that pre-skim initially. We know medication is dealt with in text B. So no medication needed. So no medication, okay? Most seizures because... and then we're looking for a reason. So it says the majority of seizures will self-terminate in less than 10 minutes and rapid treatment and medication will not be required. Not, yes. So no medication is needed. Medication will not be required would be the match there to locate. And then it says basically the majority of seizures will self-terminate in less than 2 minutes. Okay, so that symbol is less than, it's in the sentence, so we need to just put 2 minutes in the gap. Number 19, recording observations of the part of the body where a seizure started can provide evidence of their location in the brain. So part of the body, okay, I can find the word body quite easily here. Where in the body is part of the body. I can find that in text A. Can provide evidence of, okay. These all give clues. So clues would match with evidence. Okay, clues would match with evidence. So you're thinking, right, I found the right place based on my keywords. Now I need to slow down and do careful reading and decide what is actually missing. So basically, what do they provide clues about? What do they provide evidence about? In the location in the brain where the seizures occurred. Okay, so the evidence of their location in the brain would be the answer. Now, I can see the chat box is going absolutely crazy, guys, and please understand that I am doing my very best with 300 and odd students in the class. So I've gone through the answers. I basically kind of identified the keywords. We've done the pre-skim, so we know what text to go to. We locate, and then we basically do our careful reading. So we've gone through all 3 sections. We've talked a little bit. Well done, Jins. Jins is putting their score into the chat box. Good job. Yeah, so basically we've looked at technique. I'm going to open up the chat box now very briefly for you to now communicate with one another, should you wish to. So these are the answers, guys. Okay, so based on how you did, if you feel that you still need a lot more help and practice, I would recommend going onto the website and sort of having a look at what is on offer with E2 language in terms of practice and, you know, technique. So basically, if you were working on your reading skills and you were signed up to one of the packages, then you would have access to basically all of our method lessons. So you go onto the platform, click on OET course on the left-hand menu, and it would open up all the subsections of the OET. And you think, I really need to practice reading part A, for example. So you click on reading part A and you get lots of practice questions in there. My recommendation is that you need to build up knowledge of, in terms of your reading, where am I struggling? Is it part A? Is it part B? Is it part C? Then you need to do practice. You need to attend the live classes. So we're going to be putting out live classes for reading every Monday. And basically, they go out twice a day. They're uploaded and recorded, so you can go back and review what we've covered in the live class today by clicking on recorded classes in the menu if you basically sign up to E2 language. So yeah, build up your knowledge of which section that you're struggling with, then attend the live classes. We're very clear on the technique, and this is also reinforced on our platform. I would work on your accuracy first, and then you can always practice and get your speed up to snuff so you are in a good position to pass and get that B in the actual test. Just recap very briefly, okay? So what we're looking at here in terms of part A is basically we need to start with a skim to get a general sense, and my recommendation is to do that, not to skip it. 15 seconds on each text. That's not a lot, but that 15 seconds on each text means that you're going to be able to speed up your location in the later sections of the test. Analyze each question for keywords, okay, so that's really important to really guide your search, your hunt for the information. So you're going to locate keywords or matching words, synonyms to do your location in the correct text. Then you're going to slow down and do your careful reading. This is for the short answer and the sentence completion questions. Remember, when you're lifting information from the text to put into your short answer and sentence completion, don't make any spelling mistakes, because that will impact your score. And of course, for the sentence completion, do a final check through. Just make sure it reads grammatically correctly.